started when I was a nurse. I graduated as an RN in 1951. In one way or another, I have been part of the hospital. St. Mary's has been my home and still is. In that time, I have done patient care, mainly on pediatrics. I was on pediatrics about 25 years. In that time, I also worked in nursing service, which meant that I dealt with all the floors at one time or another. And in that time, I also had my training in pastoral care. And then I ended up in pastoral care. I'm still there. So I preferred working with children, but I also worked with adults and in many different areas. My favorite part of pastoral care is working with the dying, working with cancer patients. I love doing that. Just being with the cancer patients is very special for me. I would like to spend as much time as I can with them. I like to hear their stories. They always involve the family, so I'm working with families also. But that has been my favorite, and it still is. I hope to see a lot of what has been in the past, and that is working with one another. We have so many wonderful employees, and I hope and pray that they will continue being as serviceable as they are. They seem to reach out to the patients and are very close to the patients. I'm sure that in the next 100 years, we will still see this in our employees. I can see how they are practicing their mission and values with those that they work with, not only with the patients, but also with each other. I've always been impressed with our employees, still am, and I know I'll always be impressed with them. You know, there was a time during the Depression time that people were coming in to the hospital. They needed care, and our hospital was not completely developed. But the doctors needed the hospital, and they had a drive for the community to donate so that we could build. And it was amazing how many people contributed, and it was so successful that we were able to start building even in the Depression time. So we're grateful to the community. The community has been very close to St. Mary's, and I think the community will always give what they can and more, which they do every day. What we've done in the past and what we're doing now, and that is having great respect and love for one another. This is what has built St. Mary's. The employees, all those who worked here, have given of themselves completely and have practiced those virtues, those values, and our mission. We see it in the employees every day, and this is what needs to be continued in the future. I'm Sister Joanne. I'm part of the legacy.